start by gathering my equipment. I got my stethoscope, my reflex hammer, pen light, my tongue blade. I have my hand hygiene. Knock, knock. Good morning. My name's Nicole. I'm going to be your nurse today. Can I have you identify your name and date of birth?
Nicole Jellison, April 16, 2001.
Okay, so I'm here to do your head to toe assessment. Do you have any questions before I get started?
Nope.
Okay, I'm going to start by assessing your head. I see it's normocephalic, no evidence of microcephaly or macrocephaly. I see it's symmetrical. Is it okay if I touch your hair? Okay, I'm going to get my equipment. I'm going to start palpating. Do you feel any tenderness?
No.
No evidence of any masses or lesions. I don't see any evidence of pediculi. The hair is evenly distributed, blonde color, no evidence of alopecia. Moving my way down to the face. Can you look at me? Okay, I see that it's evenly symmetrical bilaterally. I see that there's no masses or lesions. I'm going to test for cranial nerve 7. Can I have you raise your eyebrows? Furrow your eyebrows down. Can I have you smile without teeth? Smile with teeth. Frown. Puff out your cheeks. Purse your lips and whistle. Okay, I see that the cranial nerve 7 is intact. The patient was able to move their face symmetrically. No evidence of involuntary movement. Moving on to the eye, I see that the eyebrows are symmetrical bilaterally. Hair is evenly distributed and the hair color is brown. Moving on to the eyelids, I see that there's no swelling, masses, or lesions. No evidence of ptosis. I see the upper eyelashes move up, bottom eyelashes move down. Is it okay if I touch you? Okay, seeing the conjunctiva, I see that it's pink and moist. No evidence of any foreign bodies, masses, or lesions, or abnormal discharge. I see that the cornea is transparent and clear. The sclera is white. No evidence of yellowing, bluish, or redness. I see that the iris is blue bilaterally. And now I'm going to get my pen light. I'm going to do the corneal light reflex. I'm going to put my pen light in your eye, okay? Or looking at your eye. Okay, I see that the light reflects off bilaterally. Next, I'm going to be testing the cranial nerves 3, 4, and 6. I'm going to have you follow my pen light without moving your head, okay? Okay, I see that the patient was able to follow the pen light without moving their head and no evidence of nystagmus. Next, I'm going to check the pupillary reflex. I'm going to shine my light into your eye, okay? And I'm going to have you look ahead, okay? Okay, I see that the pupil constricts upon the light response. Next, I'm going to do the consensual pupillary reflex. I'm going to cover the eye. Okay, I see that both pupils constrict in response to the pen light. Next, I'm going to have you stare off at that frame. And I see that both pupils dilate upon looking at the object in the distance. Can I have you look at my pen light? I see that both pupils constrict upon looking at my pen light up close. I see that the pupils are equal and round and reflective to light. No evident and reflective light and accommodating. Next, I'm going to go and check the ear. I'm going to palpate the ear, okay? Do you feel any tenderness? Okay, I see that the patient feels no tenderness, no masses or lesions. I'm going to palpate the tragus. Do you feel any pain? The mastoid process, do you feel any pain? No. Okay, I see that the patient feels no pain in the external ear. Next, I'm going to do the whisper test. I'm going to go 2 feet behind you. I'm going to have you cover your right ear, okay? And you're going to repeat the 2 words that I say, okay? Peanut butter. Okay, I see that the patient has no hearing loss in their left ear. Okay, next I'm going to get my otoscope. And I'm going to look into your ear, okay? I'm going to have you push your head back. I'm going to pull up and back on the pinna, and I'm going to look into the ear. I see that the auditory canal is pink, no evidence of foreign bodies, no masses or lesions, an even amount of cerumen. I see the tympanic membrane's a pearly gray color. It's a concave in shape, and I see that the cone of light is at 5 o'clock. Next, I'm going to go back to the nose. I see that the nose is at the midline of the face. No evidence of any masses or lesions. I'm going to palpate the sinuses. Is it okay if I touch you? Okay. Do you feel any tenderness? Do you feel any tenderness? Okay. Next, I'm going to get my pen light. I'm going to have you put your head back. Like, put your head like this. Okay. I see that there's no deviated septum, no polyps. The mucosa is pink. No evidence of irritation. Next, I'm going to inspect the mouth. I see that the lips are pink and moist. No evidence of any dryness or cracking. Next, I'm going to have you open up your mouth and come on. Okay, next I'm going to have you say, open your mouth and say ah. Okay, I see that the uvula retracts and that cranial nerve 10 is intact. I saw that the tonsils are 1+ grade bilaterally, no evidence of any swelling. The oral mucosa is pink and moist, no evidence of any masses or lesions. So next I'm going to have you do your tongue range of motion. Can I have you stick your tongue out, up towards your nose, down towards your chin, side to side? Okay, I see that the patient has full range of motion for their tongue, no evidence of any pain upon movement. Next, I'm going to test for cranial nerve or your neck range of motion. Can I have you put your head all the way back, all the way to your chest, side to side, ear, and then look side to side. Next, I'm going to test for cranial, and I see that the patient has full range of motion for their neck, no evidence of hesitancy upon movement. Next, I'm going to test for cranial nerve 11. I'm going to have you push your head towards my hand. Okay. Try to turn your head towards my hand. Okay, I see that, and now shrug your shoulders. Okay, I see patient has 5 out of 5 strength in their neck and their shoulders, and cranial nerve 11's intact. Next, I'm going to move down to the upper extremity. Okay, I see that the skin color is intact with the rest of the body, along with the hand. I see that the nails are pink and smooth, no evidence of ridging or splitting. Can I have you put your nail beds like this? Okay, I see that the nail bed's under 160 degrees, no evidence of clubbing. I see that the capillary refill is under 2 seconds. Next, I'm going to do, and then, let me see here. I see that the skin tuger is elastic and bounces back, no evidence of tenting. Next, I'm going to have to do the range of motion for your upper arm, okay? I'm going to have you extend, flex. Now I'm going to have you put your hands like this, hands like this, hands like this, all the way out, back. I'm going to have you put your fingers to your palms, fingers all the way out. I'm going to have you put your fingers like this, spread them out. Okay, perfect. I see patient has full range of motion for their elbow, wrist, and fingers. Next, I am going to test for strength. So I'm going to have you pull on my hand. Okay, now I'm going to have you push on my hand. Okay, now I'm going to have you put your wrist up. Okay, and next I'm going to have you put your hand up. Okay, and now I'm going to have you pull on my fingers. Grab my fingers. Okay, perfect. I see that the patient has 5 out of 5 strength for his elbow, wrist, and fingers. Next, I'm going to do some coordination. So I'm going to have you take your fingers like this. I'm going to have you alternate touching your nose. Okay, next I'm going to have you touch your finger to your nose and then to my finger with one hand. Yes. Okay, so I see that and now I'm going to have you go touch all fingers to your thumbs. Okay, next I'm going to have you go like this. Okay, I see that the patient has coordination in his upper extremities. Next, I'm going to move to listen to your lung sounds. Okay, I'm going to have you turn to me. Okay, so I'm going to inspect the posterior thorax. I see that it is elliptical in shape, no evidence of any asymmetry, and I see that the skin color is intact with the rest of the body. Now I'm going to auscultate, and I'm going to need you to take a deep breath in and out every time the stethoscope hits your back, okay? Okay. Ready? Okay, I'm going to feel for the scapula in the middle of the back. In and out. In and out. Can you breathe in and out? In and out. 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 Okay, perfect. I hear that the lung sounds are normal with no evidence of any adventitious sounds like wheezing, crackling, or rhonchi sounds. Next, I'm going to auscultate the front posterior, or I'm going to inspect the posterior thorax. And I see that is elliptical in shape, it's symmetrical. I'm going to start off by taking your pulse, okay? So I'm going to take it for 60 seconds. I see that the pulse is 2+ grade, no thrills or heaves. Next, I'm going to pretend like I'm taking the pulse, but I'm going to take respirations for 60 seconds. And I see that the respirations are normal with deep breaths, no evidence of any accessory muscle use, okay? So next, I'm going to auscultate the posterior lung, and I'm going to have you sit up straight, okay? And I'm going to have you take a big, deep breath in and out every time it hits, okay? I'm going to start off by taking the bronchial, so I'm going to feel for the trachea, in and out, in and out. I'm going to go down to the second intercostal space, in and out, in and out. I'm going to go bronchiovesicular, 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 bronchiovesicular. Okay, perfect. So upon auscultation, I don't hear any adventitious sounds like wheezing, crackling, or rhonchi. Now I'm going to have you lift up your arms like this, and I'm going to listen to the side of your lobes of your lungs, okay? In and out, 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 in and out. Perfect. Upon auscultation, I do not hear any evidence of crackling, wheezing, or rhonchi adventitious sounds. Okay, next I'm going to inspect the precordium. I don't see any visible pulsations. Can you sit up straight, please? And I don't see any visible pulsations, thrills, or heaves. And now I'm going to have you lay down, okay? Okay, and I'm going to have you put your arms at your side, okay? So I'm going to start off by taking the apical pulse at the 5th intercostal space for 60 seconds. And I feel that is a normal rate and rhythm, no thrills or heaves. And yeah, so next I'm going to auscultate your heart sounds with the diaphragm of my stethoscope. I'm going to start off at the aortic point at the 2nd intercostal space. Next I'm going to move over to the pulmonic side on the left sternal border at the 2nd intercostal space. Then I'm going to go down to the 3rd intercostal space at Erb's point. Then I'm going to move down to the 4th intercostal space at the tricuspid valve. And then I'm going to move over to the 5th intercostal space at the 5th intercostal space. And upon auscultation with my diaphragm, I hear sounds 1 and 2. I hear sounds 2 louder at the base of the heart, sounds 1 louder at the apex of the heart, and I do not hear any evidence of sounds 3 or 4 or any heart murmurs. Now I'm going to auscultate with the bell of my diaphragm. And I'm going to listen to the aortic point at the right sternal border. Next, I'm moving over the pulmonic at the left sternal border at the 2nd intercostal space. Next, I'm going to go down to the 3rd intercostal space at the Erb's point. Next, moving down to the 4th intercostal space at the tricuspid valve. And then I'm going to move over to the 5th intercostal space at the midclavicular line at the 5th spot for the mitral valve. And upon auscultation, I hear sounds 1 and 2 and no evidence of sounds 3, 4, or any murmurs in the heart. And next I'm moving down to the abdomen. I'm going to inspect. I see that it's flat in contour, no distended veneusture. I don't see any masses or lesions. I'm going to start by auscultating at the right lower quadrant. And I hear 5 to 30 tinkling bowel sounds. Moving up to the right upper quadrant, I hear 5 to 30 tinkling bowel sounds every 30 seconds. Moving over to the right upper or left upper quadrant, I hear 5 to 30 tinkling bowel sounds. Moving down to the left lower quadrant, I hear 5 to 30 tinkling bowel sounds. Upon auscultation, I do not hear any hypoactive, hyperactive, or borborygmi bowel sounds. Next, I'm going to move on to percussing the abdomen, starting at the right lower quadrant. And I hear tympanic sounds upon percussion in the right lower quadrant. I hear dull sounds over the right upper quadrant because of the liver. I hear tympanic sounds over the left upper quadrant. And I hear tympanic sounds over the left lower quadrant. And now I'm going to palpate the right lower quadrant. Do you feel any pain? Okay. Do you feel any pain? Okay. No evidence of an enlarged liver. Do you feel any pain or tenderness? Do you feel any pain or tenderness? Okay, perfect. Upon percussion, the patient does not feel any pain or tenderness. Upon palpation, no abnormal masses or nodules in the abdomen. Next, I'm going to move down to the lower extremity. I see that the skin is intact with the rest of the body. I'm going to see the nails that are smooth and no evidence, and pink, no evidence of ridging or splitting. I see the capillary refill is under 2 seconds. I'm going to have you stand up or sit up, okay? So I'm going to take your dorsal or posterior tibial pulses and your dorsalis pedis pulses, and I see that both are 2+ bilaterally, no abnormal thrills or heaves, and they are bilaterally even. And next, I'm going to do some range of motion exercises. I'm going to have you do your flutter your feet. Okay, I'm going to have you do a figure 8 with your feet. Perfect. Can I have you run one foot down the other shin? Okay, or the heel of your foot down the other shin. Okay, perfect. Next, I'm going to test for the patellar reflex, and I see that the patient has full range of motion of their lower extremities with no hesitancy. Okay, ready, set, go. I see the patient has a 2+ reflex when you hit with the patellar reflex. Next, I'm going to have the patient stand up. Can you stand up? Okay, stand up straight. I see that the patient's posture is symmetrical, no evidence of lordosis or kyphosis. Can I have you turn this way? Both their whole body. I'm going to be bent over. Okay, I see that the spine is at the midline of the body. No evidence of scoliosis. I see that the hips are symmetrical and the shoulders are symmetrical. Okay, I'm going to have you do some range of motion. Can I have you extend all the way back, all the way forward, side to side, and then I'm going to have you rotate. Okay, I see that the patient has full range of motion of their spine, and there is no hesitancy upon movement. Next, I'm going to have you do some walking exercises. I'm going to have you walk to about right here regularly, okay? Okay, I see the patient has a steady gait and does not lose posture or balance. Next, I'm going to have you do heel to toe over. Okay, I see the patient has full range control and no loss of balance. Next, I'm going to have you stand on one foot with your eyes closed. Okay, I see that the patient does not lose balance. Okay, perfect. Next, I'm going to have you open your eyes and hop on one foot. Can you do it?
Yeah.
You don't have to close your eyes.
You said close
Okay.
your eyes.
Okay, perfect. So the patient does not lose balance and is perfect. And now I'm done with my head to toe assessment. You can have a seat and the doctor will be in to speak with you, okay? Thank you. We're done.